Been a lot of confusion this week after a change in how positive cases are being reported here in Illinois. We turn now to CBS 2's Chris Ty, who's been looking into those numbers and how they've changed and how they're tracking them. Chris.
Brad, top line number here is over 15,000 new cases in Illinois today. Let's pause on that for a second. That is 3 times the number of cases the state had this time last month. It's the single biggest day jump in cases any state in this country has ever seen in COVID-19. Governor Pritzker calling this a crisis. And we want to point one thing out. The way they calculate this number of new cases has changed a little bit, not meaningfully, but a little bit. We want to get under the hood of it. Let's go and tell you this. This is how they used to calculate it in Illinois. Until last Friday, the state's confirmed new cases were calculated by using lab-confirmed cases, those using molecular testing. Well, now, at the direction of the CDC, they're including probable cases, too, which includes rapid tests that some are concerned bring more false positives, creating higher numbers. Clinically speaking, probable tests meet clinical criteria, and epidemiologically linked could also mean a positive antigen test. Bottom line, though, Illinois' top doc says probable tests are 90% reliable.
Are there a few cases in which it won't be perfect? Yes, that's true, but that doesn't mean that you're going to throw away a positive pregnancy test and say that there's no way you could be pregnant. So I think people just need to wrap their arms around this test and understand it's a very good test.
So, you know, this idea that we're piling on tests and trying to make it look, listen, nobody wants to have more positive tests showing up in the state of Illinois. What we do want to know, though, is if people are positive.
So of the 15,000 new cases today, 1,050 of them come from the new bucket of probable test kits. So, Brad, even if you removed those from the grand sum today, we'd still have 14,000 new cases in the state of Illinois, a jaw-dropping number.
Okay, just to put you on the spot here. So 1,000 coming from that new probable bucket. And as they said, likely 90% of those are positive. So you're only looking at like 100 potentially not of that 15,000, right?
Yeah, so there's 6 figures. There's 100,000 that were taken in the sort of rapid column, if you will. And of those, 14% were deemed positive. So that's where we get to this 1,050 number. You add that to the traditional way of counting, and that gets us to our grand total of 15,000. And a lot of people are saying, oh, people are trying to make a lot of this. The bottom line here is it's the new way of counting coast to coast. The CDC's mandating it.
Yeah, okay. And still a lot of numbers, bottom line. Chris, the governor, too, and the top doc asking some tough questions of the citizens of Illinois.
That's right. Dr. Ezike says she gets stopped all the time. People saying, what are you doing to get us through all of this? And she kind of turned the tables today saying, listen, we are doing our fair share here at the Thompson Center and around the state. What are you doing, resident of Illinois? Asking residents of this state to take a little more ownership of the matter, washing hands, social distancing, wearing the mask. And 2 quick nuggets, Brad. There was no news today on a new state lockdown. A lot of people were wondering. And the governor saying that hospitals in this state are not being overrun, but he says the trajectory is quite troubling.
Yeah, it is troubling. We just went over that. Chris, thank you for your work this week. Chris Ty.